precautions. I won't spend a lot of time here, but standard precautions are the basics of IPC precautions. These are the precautions that we use for all patients at all times, irrespective of their disease status, irrespective if they're a suspected or a confirmed COVID patient. These are the minimum prevention measures that we are going to apply to all patients, regardless of why they are presenting to our healthcare facility. There are 8 of them. These are the 8 standard precautions. I'm going to focus a little bit more today on hand hygiene, PPE, safe injection practices, environmental, and then medical device decontamination and disinfection. So just to let you know, today in terms of maternity care, I've selected the 5 standard precautions that are really the most critical for that patient population. So I'm going to take a deeper dive into those. So again, with COVID-19, we are learning more and more every day, but one of the things that we are learning is just how critically significant the virus likes to stay on our hands if we don't actually wash them and disinfect them appropriately. So remember, our hands are coming in contact with many different services when we are providing care to patients. And so we want to make sure that we invest a lot of time, especially during this COVID pandemic, and making sure that we are engaging in effective hand hygiene. Now, this is because hand hygiene really is the most important IPC precaution. One of the things I always like to tell participants is that if I were to take a swab right now and just swab your bare hand and put that swab on an agar plate and then sit it in an incubator for about 48 to 72 hours, I could then potentially grow anywhere from 50 to over 500,000 different types of microbes just from your hands. So hand hygiene is super important and is really the most important and foundation of all of the standard precautions that we can utilize as healthcare workers. It is a generic term that actually incorporates 3 methods. So when I talk about hand hygiene, I'm actually referring to an umbrella term that incorporates hand washing, which is actually washing the hands with soap and water. I'm also talking about the utilization of alcohol hand rub, and I'm also talking about surgical hand antisepsis. So the reason I spend a little bit of time differentiating these 3 different types of hand hygiene methods is because they're all utilized to obviously disinfect our hands, but the mechanism of action is very different for these 3 different methods. Hand washing with soap and water is actually an action that physically removes microbes and organic material from your hands. The difference between that and the utilization of, say, an alcohol-based hand rub is that hand rub actually reduces or inhibits the growth of microorganisms on the hand by killing them directly upon contact with the alcohol solution, which is also a different mechanism of action than surgical hand antisepsis, which is actually the complete removal of any and all transient flora on the actual hands to make sure that the hands are sterile before we go into a surgical theater setting and then perform a sterile technique. So one of the things I always like to emphasize is that when we talk about hand hygiene, we have to be careful in the way that the terminology that we use, because we could be talking about any one of these 3 different mechanisms. So hand washing with soap and water should be your first choice of hand hygiene method when your hands are visibly soiled. So if you are working in the maternity ward and you have a woman who is starting to go into labor and you have gloves on and you're still going to be dealing with bodily fluids and blood and come in contact with any type of bodily fluid, then you would want to make sure that if your hands are visibly soiled, you use actually hand washing. Because again, remember, we want to physically remove organic material from our hands. Now people will say, Ebeth, if I'm wearing gloves and I come in contact with blood, why do I then need to wash my hands? Well, we're going to talk about that. Even if you have gloves, a lot of us are clinicians on the webinar today. You can still potentially get blood splatter up your arm. There have been times where you can get blood splatter inside the glove. So anytime you see organic material on your hands, you want to actually physically wash away that organic material with soap and water. If your hands are not visibly soiled, alcohol hand gel is actually the preferred method to use. The reasons that we prefer alcohol hand gel is because it actually is more effective at killing microorganisms than soap and water is. Because remember the mechanism of action. Hand washing physically removes the microbes, whereas hand alcohol-based gels actually reduce and inhibit the growth of microorganisms. Using alcohol-based gels requires less time than hand washing. It can be performed at the patient point of care, and it doesn't require water, soap, or paper towels or additional resources. So that's something I always like to point out, that if your health facility has hand sanitizer available and your hands are not visibly soiled, utilizing an alcohol-based product is the way to go. Can anyone tell me how long it takes to wash your hands with soap and water versus washing your hands with alcohol hand gel? Can anyone tell me? Is there any brave souls who will be willing to chat to me this morning? I love it when people chat to me. I talk a lot, but I love to also be talked at. I see 30 seconds, 20 seconds, 40 to 60 seconds. Okay, let's talk about it. So, just want to go back to my slide here. Share. Can you still see my slide?
Yes, we can see your slide.
Okay, I'm trying to advance it, but it wants to give me fits. Okay, so I see lots of different responses. Uh-oh. I'm trying to advance, but it's giving me fits. Okay, can you still see that I'm on the next slide now? Some considerations.
Please put it in slideshow.
Okay, good. Now we're in the business. So, some considerations for implementing hand hygiene stations and maternity OPDs for COVID-19. So, you were correct. For hand washing with soap and water, we need 40 to 60 seconds. It takes longer to physically remove organic material from the hands than it does to kill microbes on contact. When we're using an alcohol-based hand gel, we need 20 to 30 seconds. It takes much less time when we're using an alcohol-based gel. So what I like to say is if you are in a health facility that has running water, then the gold standard, of course, would be that you have running water and you use liquid soap to engage in hand washing when your hands are visibly soiled. If your healthcare facility does not have liquid soap, then you can use bar soap, and we'll talk about bar soap in just a second. Each time you wash your hands, you need to use 2 to 3 milliliters of liquid soap or 2 to 3 milliliters of alcohol hand gel to be able to thoroughly get either a good lather or to get enough alcohol hand gel on your hands so that by the time that you get to the end of 30 seconds, the hand gel isn't dry. How many times have we used alcohol hand gel only for it to dry on our hands before we've been able to finish getting all of the surfaces of our hands? It's happened to all of us, right? Happens all the time. Well, you have to have actually quite a bit of liquid soap or hand gel to be able to ensure that you can get sufficient coverage on your hands. So I would like you to remember that if you're using liquid soap, 2 to 3 milliliters is roughly 2 to 3 pumps on a standard soap dispenser. And then 2 to 3 milliliters is 2 to 3 good squirts from an alcohol hand gel that doesn't have a pump. Okay? Now, I understand in our region, a lot of our healthcare facilities don't have access to running water or they don't have access to liquid soap. As I said, bar soap is okay. The only tricky thing about bar soap is that after each use, you have to make sure that the bar soap is kept dry. I see a lot of times where bar soap will be left on the sink. It'll be left inside a soap dish where there's water all around the soap, and then the soap starts to break down. If the bar of soap is not dry or allowed to dry on a rack, you start to grow microorganisms on the very thing that you're trying to use to clean your hands. So it's really important that we don't allow bar soap to stay moist because it just will allow more bacteria to grow on it if it's left moist and in water. If your healthcare facility doesn't have running water, we can also implement hand hygiene, of course. I know a lot of you, all of you are familiar with Veronica buckets, jerry cans, water jugs, all of the different creative ways here within our region that we can actually engage in hand hygiene. Absolutely, if your healthcare facility does not have liquid water or they do not have bar soap, the last case scenario is to use chlorine solutions of 0.05% can be prepared and placed within a Veronica bucket, a jerry can, or a water jug. Now, I know that right now WHO really doesn't want us to use chlorine like a lot of us used it during the Ebola epidemics to wash our hands. But what I like to do in my trainings is I like to give you options. So the gold standard would be is if all of our healthcare facilities in our region had running water and liquid soap. But the reality is that we may not always have those resources. So if we don't have running water and we don't have liquid soap, we can still wash our hands using bar soap and Veronica buckets with water in them. Or the third option is if we don't have running water and we don't have bar soap, we can always make low concentrated chlorine and put those in our hand washing stations. Okay, where do we need to put these hand washing stations in our maternity outpatient departments? This is very, very important. So hand washing stations need to be at the entry and exit points into any antenatal clinic or department. Patients have to be required to wash their hands before entering the clinic, and ideally they would be asked to wash their hands as they exit the clinic. I know that it's much harder for us within the clinical setting to monitor behavior, particularly as patients are leaving the clinic, because depending on how our clinic is organized, you know, patients may be going in a lot of different directions as they exit our clinic. But the one thing we must do is make sure that we have hand hygiene stations at the entry points into our facility way before we allow patients to come into a waiting area or one of the consultation rooms. If you have a clinic where the waiting area is outside, so a lot of our clinics, in our region, we will have patients wait outside on benches, right, before they actually come into a building or into a consultation space. If we have patients waiting outside, then we want to make sure that we have 1 to 2 hand washing stations available for those patients to wash their hands before they sit down to wait to be called to care. It's also paramount that we have hand washing stations and where toilets are. Ideally, in our clinics right now during COVID-19, we would have toilets for patients and then toilets for health workers. Ideally, we would have 2 separate toilet facilities, and we would have hand stations available at both. Hand washing stations should also be placed in each patient care area to ensure access for health workers, especially, but also patients. So for example, if a patient is being moved from a waiting area into a consultation room, or maybe in our context, we don't have a private consultation room, but maybe we have the ability to put up a privacy curtain before we do any sort of physical assessment on our patients. We want to make sure that we have a hand washing station as close to the point of care as possible, particularly so health workers can utilize those stations while they're conducting examinations. How many times have all of us worked on a ward in a healthcare facility where it's an open ward and there are 40 beds in the ward, and the one sink or the one hand washing station is way across on the other side of the ward, and we have to literally walk all the way across the ward to get to that one sink or that one hand washing station? How many times has that happened to all of us? How easy is it then for us to not wash our hands, right? Because we're busy, we have so many patients we have to tend to, and it becomes very hard for us to keep walking back and forth, back and forth, back and forth. That's why during an epidemic and a pandemic, if we can set up quick hand washing stations with Veronica buckets at the point of care, it really is a good practice to utilize and implement. The important, though, of hand hygiene station is that they have to be installed, supervised, and regularly refilled. So during an epidemic and a pandemic, generally what has to happen is that this has to become the responsibility of somebody. If there isn't already a designated person in the healthcare facility who's responsible for ensuring the hand hygiene stations are refilled with the resources that they need, then we might have to assign roles and have that become somebody's tasks, either a cleaner or a porter or another health worker, to ensure that we always have availability of stations. And of course, we would always want to make sure that we have an actual maintenance schedule. I don't have to tell you, these Veronica buckets, the water inside, the chlorine solutions inside, they go very quickly, and they're made of plastic. So, they break down very quickly. So we would want to make sure that we have someone monitoring them at all times. So this is the way to perform hand hygiene. Unless you want me to, I'm not going to go through the actual steps, but I just wanted to emphasize that when we use water and soap, we wash for 40 to 60 seconds. I know that there are a lot of creative ways to remember how long 60 seconds is. I know a lot of people sing songs. Some people will do a prayer. There are lots of different ways to make sure that we have washed for the duration of time that we need. And then of course, if we're using alcohol-based hand rub, 20 to 30 seconds. Okay, here is another reminder, and then if you have time, of course, these slides will be available to you after this webinar, and this is a video that you can watch to see how to engage in hand hygiene. One more time, just showing you the differences between the two methods, soap and water and alcohol rub. Now, here are the 5 moments of hand hygiene, and these are critically important during an epidemic. If you do not wash your hands at any other time of day, please make sure you are washing your hands while you're caring for pregnant people during the COVID-19 epidemic and these 5 moments. You want to make sure that you wash your hands before touching the patient, right? Because we also want to make sure that if we have pregnant patients that are coming into our healthcare facility, they're already vulnerable, right? Because they're going to be having a baby very soon. They're already highly susceptible to other infections already. We want to make sure that we are not introducing any more microbes onto our patients or our patients' belongings, including environmental surfaces, while we are caring for them. The one thing that's so important during an epidemic and a pandemic is to ensure that we are not creating health-associated infections of any kind, both of COVID-19 and then also being mindful that we don't allow other types of infections to be spread at the same time. A lot of times what happens during an epidemic or a pandemic is that we get so focused on the actual pathogen during the acute emergency that a lot of other good practices will go to the side, and we actually start to see rates of increase of other types of microbial infections, like Staph aureus always goes up in healthcare facilities during epidemics. C. difficile infections become more prevalent. These types of infections, we also want to make sure that as we're dealing with at-risk populations, we're not exacerbating healthcare associated infections. We also want to make sure that we wash our hands and do sterile antiseptic procedure for hand hygiene before we do any sort of clean or aseptic task. So this would include any type of obstetric emergency, C-sections, things of that nature that we have to do that are very invasive to ensure the well-being of mother and baby. After we have touched our patients and before leaving the patient care area, after we have touched patients' belongings and surroundings. So the one thing I should say is that COVID-19, this virus is very tricky. It likes to live on surfaces for a long time. It can live anywhere from 4 hours to 9 days on different types of surfaces. And if you would like, towards the end of the webinar, I'm happy to actually break down the duration of time the virus can live on different surfaces if you would like me to. But we know from the literature that patient belongings are just as contaminated with microbes as the patients themselves. Can anyone tell me of women, what's the number one thing that we as women, it's something that we wear, it's an accessory that we have that has the most microbes on it than anything else that we carry on our person? Can anyone? The next thing we're going to talk about that is especially important right now during COVID-19 is respiratory hygiene. So this is a precaution that prevents the transmission of all respiratory infections in healthcare settings and of course in our communities. But it is a good practice when you have good respiratory hygiene, or sometimes it's called cough etiquette, to reduce the spread of microorganisms. This is particularly important with our maternity patients because, again, as we've noticed, they're high risk. So what are the steps for respiratory hygiene? The steps for respiratory hygiene is that if you are going to cough or sneeze, you need to cover both your nose and your mouth. There are lots of misconceptions that if you just cover your mouth, then you're actually doing good respiratory hygiene. The reality is that the microbes of COVID-19 like to live in our laryngopharyngeal pharyngeal area. The laryngopharyngeal pharyngeal area is directly connected in the back of our throats, directly associated with both of our mouth and our nose based on its position in our anatomy. So if you don't cover both your nose and your mouth when you're coughing or sneezing, you're not doing yourself good service and the service of your patients because you're not adhering to good respiratory hygiene. You want to cough or sneeze into your elbow, inside of your shirt, or by using a tissue, okay? If you use a tissue, you want to throw it away into the waste bin immediately. You always want to face away from others when you are coughing and sneezing. And then after you have done respiratory hygiene, immediately wash your hands. So if I can say one thing today is respiratory hygiene and hand washing, they are brothers. They are sisters. If you do one, you must immediately do the other. When you cough or sneeze, even when you cough into your elbow or you cough into a tissue or down the shirt, your hand is involved in those actions in some way, shape, or form. Because when you go to sneeze, even when you sneeze in your elbow, you have to pass your hand first, right? And long before we actually sneeze, the minute we open our mouth, we're releasing microbes. So you must immediately wash your hands after you cough or sneeze. Here are some considerations for respiratory hygiene with maternity outpatient departments. As I said, respiratory hand hygiene, they go hand in hand. This applies both to health workers and patients. So if you have women who are coming for their regular antenatal visit and they are in a common waiting area, the one thing you want to make sure that you are doing is that you educate them on respiratory hygiene and that you have visible signs or posters or notation somewhere so that they can know what are the appropriate steps for hand hygiene. The other thing you want to do when a patient comes and is being triaged, when we'll talk about triage in a minute, is you want to provide patients that have respiratory symptoms a medical mask. If your healthcare facility has medical masks available, it's very important that we give patients that have respiratory symptoms a medical mask. This is what we call source control in IPC. Source control means that we're providing the person who has symptoms a way of preventing them from spreading microbes to other patients or other people. Having a medical mask readily available at triage and in waiting areas is very important during COVID-19. If your healthcare facility does not have medical masks to give patients while they are waiting or being triaged, if they have symptoms, you can provide fabric masks or the patient can have a fabric mask and bring it with them, okay? But the preference, let me be clear, the preference is if patients come to triage or a waiting area and they have respiratory symptoms, we try to give them a medical mask. The reason is that fabric masks are not very effective at reducing the transmission of COVID-19. Even the best fabrics that we have available to us in our region are only about 60% effective. The least effective fabrics are only 3% effective, okay? If you have a patient coming to triage or in the waiting area and they have respiratory symptoms, you want to make sure that you at least keep these patients 1 meter away from other patients. Ideally, it is a good practice during the epidemic right now that in our antenatal clinics, we keep our waiting areas either in triage or our waiting areas for the clinic in general. We have patients maintain at least 1 meter distance away, whether they have symptoms or not, just to be extra safe, okay? Inside our triage and healthcare facility, our clinic, and in the waiting areas, we must have waste bins if we are having patients use tissues. If patients use tissues, we need an area for them to dispose of it immediately. If your healthcare facility does not have paper tissues to give patients, another option that we can use in our region is that we can actually take and cut up pieces of cloth as small squares, and we can distribute those to patients when they cough or when they sneeze. But these pieces of cloth should be used and treated just like a paper tissue. They are to be used one time and one time only, and then discarded in a